Hey, welcome back to Ask the Pharmacist. Now, I've mentioned this a few times before, but today I'm going to show you exactly how to use one of the rules of the Medicare coverage gap to your advantage to help make your prescriptions cheaper. So let's jump right in. Okay, now I call this tip the brand name drug tip. And if you're on a Medicare plan that pays for your prescription drugs, I'm sure you've heard of the phase of coverage called the coverage gap, also known as the donut hole. Now that is where this tip works. You might have also heard that the coverage gap will be closing in 2020. And that is true, but at the same time, it's not totally true, because really it's all a technicality, because what the coverage gap is just a change in how much you pay for your prescriptions. So let's look at it as far as the initial coverage phase in Medicare plans, and this is universal to Medicare plans, even if specific plans may charge you less or may charge you a copay. Starting in January, you're actually responsible for up to 25% of the cost of all your medications, either brand name or generic, until you hit a certain point where you enter the coverage gap. And once you enter the coverage gap, what has historically been true is your percentage that you're responsible for was higher than 25%. Now, every year for the last several years, that percentage that you were responsible for has gone down, so that now in 2020, it's all the way down back to 25%. So there's still a phase of coverage there. It's just that you're still only paying 25%, whereas in the initial phase you're also paying 25%. But here's the difference. Some plans are charging you copays or smaller costs for tier 1 and tier 2 drugs during the initial coverage phase. But when you hit the coverage gap, which technically is no longer the coverage gap, supposedly, that can change, because they may then increase what you're responsible for up to that 25% of the cost. Now, they can't go any higher than that. The most you can be responsible for paying is 25% of the negotiated cost, but it may be that you're paying $10 copay on a drug in the initial coverage, and then you hit the coverage gap, and it may go up to $20. That doesn't mean they're charging you more than they can. That just means you were getting it at a discount in the first phase. But the coverage gap is where this tip works, and I'm going to show you how it works. Now, the key to this tip, even though it works in the coverage gap, is not really getting you to the coverage gap. It's actually getting you through the coverage gap. Because what we're trying to do here is to get you past those first levels of coverage or phases of coverage of your plan and get you into the next phase of coverage that's called catastrophic coverage phase. In the catastrophic coverage phase, you're only responsible for 5% of the cost of your drugs versus 25% in those first phases. So the problem we have here is, how do we get you to the catastrophic coverage phase by spending as little of your money as possible? And that's what I'm going to try to help you do. At the beginning of the year, after the cost of medications that you pay yourself added to the cost of those medications that your plan pays each time you fill them, you will enter the coverage gap once you reach a total of $4,020. That is the point where you go from the initial coverage and enter the coverage gap. Now, once you're in the coverage gap, or the donut hole, they stop counting what the plan is paying, and they only count what you are paying towards getting you out of the coverage gap. And to get out of the coverage gap, you have to hit $6,350. And on a side note, that is actually $1,200, roughly, more than it is for the 2019 plan. So it's going up quite a bit. It's going to get a little bit harder in 2020 to get out of the coverage gap and enter the catastrophic phase. So this kind of is even a little more important. But what this all means is your plan and you added together got here. To get to here, you're responsible for it on your own. That means that you will be responsible out of your own pocket to pay $2,330 to get to the catastrophic coverage phase. Or, if you would like to use this tip, you could get there by paying $613. And here's how. Okay, let's say that you take a medication that has a cost with your plan at the pharmacy of $100. Now, you're responsible for 25% of that during the coverage gap. So you are responsible for $25. Now, this $25 will be used towards getting you to the $2,330 you need to get out of the coverage gap and enter the catastrophic coverage phase. But you're not going to get there very fast with $25. Now, the key here is if this is a brand name drug, then there is a rule where Medicare requires the manufacturer of that drug to chip in 70% of the cost on top of your 25% of the cost. So they will also be required to pay 70% or $70 towards the cost of that drug. And that $70 will go towards the $2,330 that you need to get to the catastrophic coverage phase. So now you actually have $95. This is still not a huge amount, but the reality of the situation is that brand name drugs typically cost more than $100 in total cost. So you're probably going to see more than a 25 and a 70 added. What you're actually probably going to see is something more along the lines of, let's say you have a drug that has a retail cost of $650. You will pay your 25% share of the $650, which is $162. The bonus is the drug company then still has to kick in 70% of the cost, and 70% of $650 is about $455. That means that brings you to a total of, for this one prescription, one fill, of $617. That's a pretty good chunk of the $2,330 that you owe. You actually only paid $162. Don't forget that. But what's going towards the plan and towards getting you out of the coverage gap is $617. Basically, if you can do this with 4 drugs, and you probably can because brand name drugs are typically pretty expensive, that will get you out of the coverage gap. Once you get to the catastrophic coverage phase, medications like the one you just used to get that $617 that cost you $162, well, once you get to the catastrophic coverage phase, you will only pay 5% of the cost of that drug. So that drug will no longer cost you $162. For the remainder of the year, will cost you $32. Whether there's 1 month left in the year or 11 months left in the year, for the remainder of the year, you only pay 5% of the cost on all your drugs as a maximum. Now, the amount that you do save will depend on how early in the year you start getting the benefits of the catastrophic phase. So if you don't usually go into the coverage gap at all, or if you don't usually even get close to getting out of the coverage gap in the full year, then this tip really may not work for you. But even if you'll hit the cheaper phase near the end of the year, you might still save a lot because you can get that 5% cost for the remaining part of the year. And if you time your refills where your refills will come due in like mid to late December, which isn't hard to do, you can just fill all those medications for a 3-month supply. And that means that basically you're taking advantage of that cheaper 5% cost for 3 months worth of medications at the end of the year. So you're using this year's coverage, or you're using next year's coverage, to pay for the medications for January, February, and March of the following year. So that's how much more money you can save by tacking on 3 extra months to the year's cost. As long as you fill them before the year ends, you still get to take advantage of that 5% share. And that is the brand name drug tip. So I hope this helped you. I hope you understand a little bit better, something you might have heard about before but maybe didn't really know the details about. If you have any further questions on it, just leave a comment, shoot me a message. I'll try to answer those. But if you can utilize this, it can really save you a lot of money. And I've definitely seen people do it. I've seen patients that set this up, and then at the end of the year, we filled a 3-month supply of all their medications, and they got them for so much cheaper than they paid for most of the year, and it really helped out a lot the next year. So hopefully you can do that too. So if this video did help you out, I'd appreciate it if you go ahead and hit that like button, and I'd appreciate it if you would subscribe, and you'll get to see more videos when they come out. I'm going to try to help with more topics, You can suggest some if you'd like to see something. Just let me know. Thanks for watching.